Oregon Health Authority. Today we are talking about measles and the measles outbreak here in Oregon. You have received our OHA media release about this, and we are offering this opportunity today to you, the media, to ask questions, and our experts are on hand to answer them. So joining us today is Dr. Howard Chio, Medical Director for Communicable Diseases and Immunizations with Oregon Health Authority, and Dr. Dawn Nolt, Professor of Pediatric Infectious Diseases at Dornbecker Children's Hospital at Oregon Health and Science University. This is a friendly reminder to please mute your audio and use the raise your hand function if you'd like to be added to the queue to ask a question. And if you'd like a recording of this media briefing, the link for the YouTube live stream will become the link for the recording, so you can watch it later when this media briefing is complete. So let's get started. Dr. Chio, go ahead.
Thanks, Erica. Good morning, everyone. Thank all of you for joining us this morning. As many of you have already been reporting, measles cases have been increasing across the United States. So this year alone, there have been almost 1,000 cases reported nationally. In comparison, last year, there was around 2,300 cases nationally in total across the entire year. In Oregon, we are experiencing our first measles outbreak of 2026 with 5 reported cases since January 1st. And it is really important to remember that these cases likely represent just a fraction of the true number of measles cases, since not everyone who becomes sick will seek medical treatment or be tested, and therefore may not be reported to us in public health. So today we are launching an Oregon dashboard that is going to share measles virus concentration levels directly from our wastewater surveillance system. And as a reminder, wastewater surveillance is when we test sewage for infectious diseases. And this allows us to have an idea of how much disease there might be circulating in communities without relying on people who are sick to seek healthcare and then be reported to us in public health. The Oregon measles wastewater surveillance system was launched last October, and data has already been viewable on the CDC National Wastewater Surveillance System webpage. However, the CDC website uses a very high threshold for calling a sample a detection or not, because it's designed to correlate with cases that are actually reported to public health. Instead, what we're doing with the new Oregon measles wastewater dashboard is to let everyone view viral concentrations in wastewater, and that's categorized as very low, low, moderate, and high. You'll be able to view this information by county over a 2-week period. And I think this is actually really important because it will give the general public and healthcare providers additional timely information about the spread of measles in Oregon. And when we look at the wastewater data, you can actually see that the measles concentrations have been increasing over time and in multiple counties across Oregon. Britt, would you mind sharing your screen for the dashboard? And can you hold on just that first date for a second? Perfect. Thanks, Britt. So I want you to pay attention to the colors here. So you'll see there's a light blue on the bottom left. The intensity of the blue will correlate with how much measles virus is detected in that specific county. You'll also see a red box on the top right there. That red box gives you the 2-week period and the end date for that 2-week period. Britt, if you wouldn't mind advancing it, and you can advance all the way to present time. So as Britt is moving the slides forward, you'll see that the colors are spreading over time, and there's low-level detects in multiple counties as we go on through to the end of 2025. For the 2-week period ending on February 7th, there were 9 counties with low levels. For the 2-week period ending February 14th, we've detected low levels of measles virus in 6 counties across Oregon. You will also have seen some counties labeled white. It's really important to remember that not all watersheds participate in the system, and the system also won't capture those who have private septic systems or otherwise not part of municipal sewers. So at OHA, we are continuing to work with our local partners both local health authorities, local epidemiologists, and also healthcare to identify cases quickly and respond appropriately. We're also encouraging vaccinations and continue to monitor all of our data sources and determining where to put our focus as the situation evolves. But my hope really is that this dashboard will help people in Oregon make informed decisions so that they can protect themselves and their families from measles. And what I really want families to hear is that measles is here in Oregon. Cases are rising across the United States, and people should really reconsider their vaccine decisions and talk to their healthcare providers to make sure that they and their families are getting the protections that they need. At this time, I'll send it over to Dr. Note, who will be sharing her perspectives. Dr. Note, over to you.
Thank you so much, and good morning, everyone. I'm so glad to be able to participate in this event and to share my thoughts as a provider, a pediatric infectious disease specialist, and what I see in the community and what I tell my colleagues and what I tell my parents and my patients. And so I want to convey 3 points that I convey to my own patients is that measles is very serious, it's very contagious, and the vaccine is very safe and really works against protection. And measles is not just a fever and a rash. All children who get measles are absolutely miserable. It can cause serious complications, including pneumonia and inflammation of the brain, known as encephalitis, and in rare instances can cause death. And measles disease poses the highest risk to unvaccinated persons, such as those who are pregnant, infants who are under 1 year of age who really can't get vaccinated, and people with weakened immune system. And it's also very interesting in the past many years that it's understood that measles disease itself can be immunosuppressive and that you can be quite vulnerable to other infections for about 12 months after you suffer through your measles. The second thing I want to tell families after saying that measles is very serious is that it is extremely contagious. Measles spreads through the air, and contagious people can spread measles 4 days even before they have that typical rash. And the virus stays airborne in the area for 2 hours, even when the patient has left that area. So it really is around, not only in the air, but when people cough and sneeze near you. And the third thing I want to remind people in terms of how serious measles is and how contagious it is that vaccinations are so incredibly important and so incredibly protective. It's very safe. It is the best way to protect against measles, particularly if you've had 2 doses, because that is 97% effective. And like all vaccines, the measles containing vaccine can have some mild side effects that go away pretty quickly, such as local injection site inflammation and redness and tenderness and some fever. The thing that I'd like parents to remember is that this vaccine has been around since the 1960s. And so we have many, many decades of safety data and protective data to show that this is the best way to protect against measles disease. So I recommend all children get 2 doses of the measles containing vaccine. If you're not sure if you or your child is protected, then talk to your trusted healthcare provider. And as Howard said, measles is here. Measles is on the rise in our area in Oregon, throughout the United States. And I would encourage parents, as has already been said, encourage parents to reconsider their vaccine decisions. Your providers are here. We are here to answer any questions and any concerns and to talk through your decisions because we want the best for your child. Thank you. Back to Erica.
Thank you so much, Dr. Noltz. At this time, we are asking our media partners to raise your hand if you have a question that you'd like to ask either one of our experts this morning, and I'll call on you. Andrew Schwartz. Go ahead, Andrew.
Hey, I have a quick question. I'm just wondering, can you help define like what outbreak means? Like when OHA says there's an outbreak now, but then we hear there's 5 cases. Like again, that number doesn't sound like that much, and I'm just trying to. But I take your point that well, there's probably far more cases out there that haven't been counted. So help me understand like how OHA makes the determination that there is a outbreak.
Yeah, I totally appreciate that question. So the outbreak criteria that we traditionally use is three or more linked cases. And when we say linked, it means that there's a transmission connecting the cases. What I want to emphasize is that protecting privacy is really important to us, and especially when there might be children involved. So we're not able to provide more details about the cases at this time, and that includes, personal details, the case linkage, gender, age, county of residence, things like that. For us, why we're doing this availability today is because what we want to do is make sure that we're moving public health forward with the best data that we have. So we are supplementing our decision making with the new wastewater data that we are now analyzing in this specific fashion, because we want to make sure that patients, families have the best and most timely information to make the decisions that they need when they're considering their own vaccination decisions. I'm going to point everyone to the OHA Measles homepage. There you can find updated case counts and other information as much as we can provide on there while we are continuing to protect privacy. And I also think that the wastewater dashboard is going to be a really great way to empower people so that they can view their own data in their communities directly.
Oh, I had a question. Has the federal definition of an outbreak changed at all, or is there any difference between how Oregon defines an outbreak and the CDC now that we should be aware of?
We're here primarily to talk about the measles situation in Oregon. I know a lot of different states will define their own outbreaks in different ways, and there may or may not connect with official CDC definitions. For us, the definition has always been three, but again, we want to make sure that we are providing the best information that we can to communities, which is why we're doing this notification today and releasing the dashboard today.
Great. And now we're going to hear from Julia Lopez. Go ahead, Julia.
Hi, sorry, I did not unmute. Thank you. I have two questions. First, I'm wondering if you could kind of elaborate for those who are living in those communities showing low level rates at this point. What exactly does that mean for them? What should they be on the lookout for and concerned about? And secondly, when was the last time that we in Oregon saw numbers and saw rates of this high?
Yeah, I
Ira,
can
you
take
want me
that
to take that
first.
one? Oh,
Um,
darn it. I want to take
I
that
was,
one.
I was going to say, then let me talk about the system first, and then
Oh,
I
okay,
can
you
pass
go
it to
then. And then
you
I'll
to talk
answer
about
Ms.
what.
Lopez's
Yeah,
question. Go,
perfect.
Howard.
Yeah.
Go.
The first part of that question, really around wastewater surveillance. So uh, let me add a few details about what that actually is, right? So like wastewater surveillance is when we test for infectious diseases, bacteria, viruses, and we're doing that testing in sewage, right? So if you are taking a shower or using a toilet, all of that water flows out and then mixes together and then flows into a wastewater treatment facility. We then sample from there to look for disease. And it's great because it provides communities with that early warning. And because the water is all mixed together into sewage, we can't trace back to specific individuals. So it also provides privacy. On the flip side, it also means that we can't really count cases because people may shed different amounts of virus at different times, and it can be hard to go from knowing the virus concentration levels and going backwards to just how much risk that there might be. So if you are looking at the dashboard and you see a detection in your community, I really want you to think about it like a ping on a radar, right? It might be from people who are just passing through and using a rest stop, or it could also be the sign of broader community transmission. It's really important to recognize that our wastewater testing system looks for the actual measles virus that causes disease in people. And there aren't animals or other sources that carry that same virus. So we do expect that the concentration levels to roughly match how much disease there might be circulating in the system. But the technology being used in this way is still relatively new in public health, and there's still a lot for us to learn about how to use it. So for me, when we do see detections, I think it's an important reminder, one, for healthcare providers to continue being vigilant and think about measles when they're seeing patients, but it also really serves as a reminder for everyone in the community to make sure that they're up to date on their measles vaccines. And I'll pass it over to you, Dawn, for
Howard,
your
that's
additional
exactly what I
comments
was going to
there.
say. I think I just leapt to the what do I do as a clinician with my patients and my parents. So Ms. Lopez, when you asked that first part of the question, my first instinct was to make sure that if there is a community that has measles and also a community that maybe have people that are hesitant about vaccines, I encourage them to reconsider their decision. I encourage and say that the vaccine is very protective, and so vaccinate yourself, vaccinate those around you, so that that cocoon effect is super strong, like just layers and layers. Because what we're trying to do is stop the propagation of that single measles case to the rest of the community, particularly keeping those safe who are under 1 year of age, who are pregnant, and who are otherwise immunocompromised and can't take the vaccine themselves. So as a clinician, if I hear about a case or I'm worried that there's rising wastewater concerns for measles, again, really emphasizing to my patients that vaccination is key, and that if there's any questions, please reach out to your provider, and we're more than happy to answer questions, because these are going to be tough times ahead. Like, I can't emphasize that enough. Measles is on the rise and it's going to be tough. And so whatever we can do to encourage vaccination, we will be doing that. I hope that's
And
helpful, Ms. Lopez.
And for the second part of the question about historic rates, I'm going to point you to the website and the dashboards, and then there you can actually view the numbers that we have, not just compared with last year, but prior years. And I'm sure Erica can help post that in the chat.
Yes, I'm putting the OHA webpage with information about measles in now, and then I will put in the new Oregon respiratory viral pathogen wastewater monitoring dashboard in 1 second. First, though, let's take a question from the Statesman Journal. Bill, go ahead.
Yeah, hi. Thanks for taking my question. So what the majority of what I've been hearing is that the measles has been detected in the wastewater. Do we know the number of confirmed cases that of measles that we've had in these counties or that we've had in the state? As is that separate? How is that reported differently on the dashboard or something, or to the OHA?
Yeah, thanks, Bill. There's two separate systems, right? The first is that measles cases are reported to us when someone has gone to seek medical attention and there is a diagnosis of measles, and that is usually done with laboratory testing. So those cases get reported to us at public health through our local public health partners, and that includes local health authorities as well as our healthcare partners. Those numbers come in, and that is where we're reporting the total number of 5 cases. That is a separate system than the wastewater surveillance system, which is when we are testing for infectious disease in sewage directly, right? And again, that is runoff from toilets, showers, sinks, all of that water mixes together, but then we can detect the virus there. But because that is mixed water and it is adjusted for the amount of flow, we can get essentially the concentration of the virus, but it's not so easy to trace backwards to figure out exactly how many cases there are in the wastewater surveillance system. So I do want you to think about it as 2 separate systems. Each one has advantages and disadvantages. For the general public, it is really important that they are looking at both, because we think when you look at the data together, it gives you the most accurate sense of your risk in the community. And that leads you to hopefully make your most informed decisions about how to protect you and your family against measles moving forward.
Great, thank you.
Thanks, Bill. Amelia Templeton with OPB. Go ahead, Amelia.
Yeah, I'm wondering what we know about the severity of measles in modern unvaccinated populations from the outbreaks to date in this country. And because I know a lot of different things might influence how severe measles is, and I've also read some kind of confusing and conflicting stuff about whether older children might actually be somewhat more susceptible to severe measles, and I'm just wondering, what you can clarify.
I can take that one, Howard. Ms. Templeton, I think that we are going to regard measles the same, whether or not it is dropped in a population who has a high vaccination rate versus not a high vaccination rate. Um, I do believe that, if you're malnourished, you have low vitamin A, you can have more severe disease. Low vitamin A levels are not a problem in America. But I would say that when people see someone who has measles this day and age and like, oh my God, they're terrible. It's so severe and they're miserable. That's the same they were, 200 years ago. There's really no difference. And so I'd be interested if there was any additional data out there saying that measles severity would be different in this day and age compared to pre-vaccine era. But what I'd like to say is no one wants to have a child suffers from measles. It is high fever, very uncomfortable. You can have some pretty serious side effects. And so that's probably what I would emphasize, Ms. Templeton, is that disease, even contemporary times, disease is pretty bad.
Yeah, I think the suggestion I had seen was because unvaccinated children are getting it later because it's spreading still so much less than it did historically because most people are vaccinated, that there may actually be a disadvantage to getting it when you are, in middle school or a teenager, that the initial data from places like Texas and South Carolina is actually, the profile of severity looks a little worse than you might expect from other things. But
Ms. Templeton, I'd be delighted to look into that and get back to you. That might be akin to having chickenpox. When I had chickenpox at 12 years of age, I was much more miserable, I'm sure, than a 2-year-old. But I'd be happy to look into that and get back to you on that.
And I might add here, I actually took care of an older patient with measles in the hospital a few years back, and it really just sticks in my memory because I worry that people forget that measles can be a really nasty disease. And it's something that Dr. Note mentioned, that measles is not just a rash, and I think that people forget that. People think measles and rash, but it is the pneumonia, it is the brain inflammation, it's the nerve damage, and the other piece of data that really sticks out in my memory is that in the modern age, right, out of 100 people who are unvaccinated who get measles, 10% requires hospitalization, right? So out of, let's bring it down to 10. So out of 10 people who get measles, 3 will get complications. 1 will require hospitalization. 1 out of 1,000, one or 2 out of 1,000 people will die. So it really can be a severe disease. The immune suppression phenomenon is also an actual one, and those effects can last up to 3 years, where you're at increased risk for disease. And I think this is something that families often forget about when they're thinking about it, because you hear measles and you think rash, and you don't hear all of these other things about how just miserable of a disease and how dangerous of a disease measles actually is. And for me, this is why what I want people to pay attention to is that the vast majority of doctors, nurses, pharmacists, providers, everyone, like the vast majority recommends getting the measles vaccines. And these are vaccines we've had for almost 70 years. We have great data on the benefits and side effects, as Dr. Note mentioned, and the benefits that the vaccines give you greatly outweigh the risk of side effects, which are really mild for the vast majority of people. So especially now when we are seeing increased measles cases in the United States, I really want people to understand the scope of this illness. And I really want people to reconsider their vaccine decisions and make sure that they are getting protected for themselves and their families.
Thank you so much. Rebecca with KLCC Radio. Go ahead, Rebecca.
Hello. Over the last couple of years, we hear data every year about fewer kindergartners getting into the school system, being vaccinated, and year over year, it's there. They seem like small decreases, but how does, a small decrease in vaccination in, an incoming kindergarten class, how much does that increase the risk community-wide of measles? Can you talk a little bit about how these, trends of fewer school kids getting vaccinated, how much risk that adds into the community for measles?
Don, I could
May
take that
take that
first
one,
and pass it
Howard.
over to
Oh,
you.
okay.
Yeah.
Sure. That sounds great.
So what worries most for me is that the vaccination rates have declined. And we often pay attention to the statewide rate, but something that people forget and really should pay attention to is that what matters most is the vaccination rate in the communities that you spend time in. And there is great science showing that very small percentage changes in the vaccination rate in a school of 100 kids will dramatically affect the risk of an outbreak. So um, I do recommend paying attention to schools, small communities where the vaccination rates may be a lot lower, and those small percentages gives much more opportunities for that virus to spread and really cause severe disease. Dawn, over to you.
Yeah, I think that's great. People talk about the national rates of kindergarteners who have or have not the appropriate number of immunizations. But as Howard said, it's really what's happening in your community, whether or not you are in Portland or Bend or Harrisburg or Astoria. What is happening in your community, in that school district, in your church or your family gatherings. And it really depends on how contagious a infection is and how much protection is needed to keep that infection to that one patient and not spread it to the community. And for measles, we really are very focused on keeping that herd immunity, that vaccine rate very, very high because it's so incredibly contagious. And we know that in the community, we really should have a vaccination rate that's at least 95% vaccination. And right now, at least in the United States, it's 92%. So that's overall. In the communities that we are seeing this propagation of measles, vaccine rates are much lower. And so, as Howard said, really focus on what your community is doing around vaccines, but the choice is for your family. If you vaccinate your family, your child, those around you, that community, your family, that community will be protected against measles.
Thank you so much. Okay, now we have a question from Elkhorn Media. Griffin, go ahead.
I believe Dr. Chio had mentioned earlier that not all public wastewater systems participate in the data collection. Does OHA publish a list of public water systems that do participate?
You'll be able to see on the dashboard which counties are actively submitting data, and specifically for each individual time period. So you will notice the ones that are white do not have data being reported out. So that will give you a sense as to which counties are currently participating.
Thank you.
Thank you, and thanks for the question. We have a question in the chat, which I'll read. It's from reporter Carol Morton. Are you modeling the outbreak with data from these two surveillance systems and including vaccination rates? Does the model work at a state level? What about local communities? What is projecting at this stage?
I think it's really important for people to understand that using wastewater surveillance is a relatively new technology in public health, right? This has really come out in the past few years, and there's a lot for us to learn from. What's most important right now is that we do think that the data that we have, and even presented in this way alone, without additional modeling, without additional statistical analyses, is enough to really drive public health action. And that is really why we want to empower communities with the data so that they can make better decisions about their vaccination status and other mitigation measures as they are looking at the dashboards.
Thank you. And I'm just going to wait here for just a moment or two to see if any other reporters have any questions or would like to raise their hands. You can post in the chat also a question if you want. Nobody else? All right. Well, thank you so much. And in the interest of time, we will go ahead and wrap it up. And I will send it back to you, Howard. Thank you so much, everyone.
No, thanks, Erica. And I just wanted to thank all of you, our media colleagues, for helping us get the word out. Wastewater surveillance is really an early warning system. And our intention is to really give communities a head start to prepare. And it's really meant to empower communities and people to make informed decisions about immunization. And because wastewater testing looks in sewage for the actual measles virus that causes illness in people, it provides an early warning about community spread. Measles is here in Oregon. It is spreading in the United States, and vaccination really remains the best way for people to protect themselves. So we are encouraging everyone to talk to their healthcare providers to ensure that they and their families are adequately and fully protected. If you'd like to watch a recording of this media briefing, the link for the YouTube live stream will become the link for the recording once this briefing is complete. And thanks again for your time. As always, you can contact OHA's Public Health Division email, which is in the Zoom chat, if you have any follow-up inquiries. And as a final reminder, for more information about measles, the OHA website and the dashboard will be the best places to go look. I know that they are also in the Zoom chat for the briefing. But thanks again to all of you.
Bang the gong, bang the gong, bang the gong, bang it loud, bang the gong, shake the crowd, bang the gong, feel the sound. This is the moment we all crave.